I'm Ed Highland. This is DDW-TV, and I'm joined now by Dr. Robert Gish, who is the medical director for UC San Diego. Thank you so much for joining us. And you're going to be talking about hepatitis. And of course, a lot of the world is wondering, is there a cure for hepatitis B?
There is no cure at this time. We can control hepatitis B very well with oral therapies or interferon, but no cure. There's no way to get rid of this virus from the human body.
Now give us some idea about the next wave. What's happening into the next wave of trying to, treat this disease?
So with our first-line therapies that we have, and the poster that I have at this meeting is on entecavir, we showed that there was a rather profound reduction of this special intermediate called cccDNA in liver cells on treatment, and much higher reduction than with lamivudine, a therapy that's now really out of date. This is encouraging because if you reduce cccDNA, you can clear S antigen. S antigen is the home run. We were talking about home runs versus the World Series, but let's get to the home run. Clear or decrease cccDNA, clear S antigen, that's associated with a much better prognosis, lower risk of cancer, lower risk of cirrhosis, transplant, and death.
How key is improving blood tests?
It's really important. That is our first wave, is suppressing HBV DNA in the blood. And our first-line therapies today, including entecavir and another medicine called tenofovir, we can get 95% viral control. But this S antigen clearance, at best, is 10% at 5 years. So we really want to accelerate that, get more S antigen clearance, get more patients off therapy. The new drugs that are coming down the pipeline will allow us to stop these all-oral regimens and get people off treatment.
So I think you just said it, but basically we are looking at a need for new therapies.
We do. We have a huge need. There are 400 million people infected, and indefinite therapy with these all-orals, although they're very safe, is an expensive proposition, and people don't want to take medicines forever.
Dr. Robert Gish, thank you so much for joining us. This is DDW-TV.